First up, though, let's talk about something that is, well, it was inevitable, wasn't it? It would be coming back this winter. Of course, I'm talking about COVID. Well, COVID's never really gone away. I've got such a rotten cold. I've thought of taking a COVID test, and I thought, well, what would be the point of that unless I'm visiting an elderly sick relative? But plans are underway to restart. Guess what? COVID surveillance ahead of winter. Announcement came yesterday ahead of the rollout of, so after the rollout of vaccines, we were brought forward due to a new variant emerging. But is this really necessary? Let's talk about this with Carl Heneghan, Professor of Evidence-Based Medicine at the University of Oxford. Good morning to you, Carl.
Good morning, Julia.
Another day, another COVID story. I mean, is there any point in having surveillance of COVID? Do we have surveillance of flu? And what are the issues regarding this new variant? Tell us what's going on.
Well, first is that the UKHSA has come and said there's no widespread testing system for coronavirus or influenza patients in the community. Well, first thing to say, there actually is a system. It's called the RCGP surveillance system. It exists already. And you said you've got a cold, and I can tell you the most prevalent pathogen right now is rhinovirus, which is coming through young children. And as they go back to school, it'll take off. So that's where the common cold comes from. As we go into winter, there's about 7-9 pathogens that we already monitor. But here's the point, Julia. Surveillance is the collection, analysis and dissemination of results for the purpose of prevention. So you're going to talk about the concrete in schools, that's surveillance, and then you do something about it. It's not clear to me what the UKHSA is then going to do to protect us. It's just going to give us this information, and the problem is we'll end up with the usual scare tactics right through winter now. And actually, what is it they're going to do to try and prevent this? Are they going to run any trials? Are they going to try and look in care homes or hospitals that acquired infections and do something about it?
I'll tell you what they're going to do, Carl. They're going to tell us all to put masks on again. I don't want.
Correct.
You know what I don't want? I don't want the UK Health Security Agency to try to protect me.
No, it's interesting. I think there are areas where you think about certain exposures. I was looking at the sewage this morning. You want people to be alert to that and prevent it. But you want to know, surveil areas where you know what you're doing. Here's the problem, though, Julia. We're going into winter. 7.6 million people are on the waiting list. There was data last week that said 120,000 people died while on the waiting list. That's 1 in 5. We are in a crisis situation. We've got more strikes coming, and we've got the inevitable rise in winter pathogens. We're in a bit of bother, and we've got a government who really doesn't know what it's doing, doesn't know anything in terms of healthcare, and can't be overseeing the UKHSA and trying to say, here's the mandate, here's what we'd like you to do. And so I think we're in a bit of trouble this winter.
Well, but that's it. I mean, we go from winter crisis to winter crisis. Now it's winter crisis to spring crisis to summer crisis to autumn crisis to winter crisis. We're just carrying on as always. We also know we have got this massive spate of people getting rhinoviruses, very bad colds, flu as well, because so many people were isolated for a couple of years. I was amazing. I was back at work as soon as I could just basically fight my way back into the building, and was seeing people going away when I could. And we were actually, having contact with a lot of people. We'd already had COVID. We were very relaxed about it. Only person I was concerned about was, an elderly relative. That was it. And I just thought we deliberately kept up as much contact as possible, because I knew from talking to people like you how important that was. And I'm stunned by how many people I know just say they're constantly sick right now. There's been a really big issue with people, basically not developing their immune systems, particularly young children.
I think people forget that these viruses live all around us and we live side by side. You're right about this idea that what matters is your susceptibility. And so there's going to be this cycle as you go through life where you'll get more infections. If you have young children or you have grandchildren for the first time, your chances of getting infection...
September, when your kid starts a new school, basically right off the whole month, you're going to be ill for the entire month.
Correct. And what will happen is I will speak to my GP colleagues, and about 2 weeks before the UKHSA knows about it, they'll tell me about what's happening in terms of people turning up at general practice and urgent care. In doing so, you'll see this rise as children go into primary school. They're susceptible. You can expect in a bad year for a child to get up to 10 colds based on viruses. So you can see how they're harbingers of infection and put you at risk. But the point here is, like yourself, if you go out and about in the world, you are going going to face these viruses.
Yeah.
I think what the UKHSA could do is give very good advice if you've got a vulnerable elderly relative. What is it you can do to keep them safe, and when should you do that? Because it's not about staying away from them. It's about understanding quality of life is about our social contact, but making sure you don't walk in there to somebody who's 95 and give them an infection.
No, exactly. I mean, genuinely, I see my aunt, most weeks, and I called her yesterday and said, look, I've got this absolutely rotten cold. It's not me for 6. Low immunity on your part. Look, I'm not going to be, realistically, I'm not going to be able to visit you this week because I don't want to risk passing it on. That's just being responsible. It doesn't mean you don't see them again until next March.
So I think what happens here, though, is common sense advice, of which you're the home of this, Julia, gets lost in all the messages.
Yeah.
You know, wear the mask, somehow you're okay. And what happens is we continue to get these people who clamour. They call them experts. I don't know where they get their expertise from, but actually clamour for interventions for which there's not an evidence base. Yeah. Then I think that gives false reassurance to people when what you've just said is very clear, common sense advice.
Absolutely. Well, we got it from you, Carl, and I know my audience always cheers you on.